Really, it's painful to lose a mother just because of a pregnancy.
I really get disappointed when I have a maternal death.
If you want a healthy population, start with the mother from conception.
Proper sexual reproductive health means a complete state of mental, physical, and social well-being in all matters reproduction for men, women, and even adolescents. But to many mothers, giving birth is a nightmare. The entire pregnancy journey is not any better. With limited access to resources and basic education regarding reproductive health, most of these mothers opt to give birth at home, thus increasing their chances of maternity-related complications. We spoke to mothers in Kakamega and Vihiga counties who shared their pains of maternal complications.
Fili yenye nilikuwa na fili mwili ilikuanga uchungu. Kukaa ni uchungu, kulala ni uchungu. Alafu sana ilikuwa inashika mgongo. Hata ukienda haja ndogo nilikuwa naumia.
Wakati nilifika kuzaa ndio nilisumbukana zaidi sababu nilianza kuumwa saa 8 za usiku. Kuja hapa Lwesero nikakaa siku 2 kama sijadeliver.
Tena vile nilienda mama hao wenye wanashikanga wa mama wa nyumbani wengine wakaniambia mtoto amekaa vibaya kwa tumbo. Sasa ndio yenye iliniogopesha.
Priscilla Oparanya, Kakamega First Lady, attributes home deliveries to fear among most mothers.
Long before, there were a lot of explanation about going to hospital and fearing going to deliver in hospital. The women said, maswali ya clinic, nitapigwa, I'll be seen naked.
But with traditional birth attendants or TBAs now serving as birth companions to pregnant mothers, the First Lady says cases of home deliveries have reduced significantly.
They were taken to a seminar by, I think, AMREF, and these days they are called birth companions because they are the ones that accompany these mothers to clinic, and they are very important and we cannot do without them. They are the ones who know which woman stays in which village, what type of family is there, how she is.
We have sensitized community volunteers to be able to map out pregnant mothers and be able to refer them to health facilities for them to access ANC profile.
Jessica Colley, the reproductive health coordinator in Kakamega, says the county now records 66% skilled deliveries, a move she attributes to efforts by community health workers.
We had a partner called World Vision who trained all the 2009 community health volunteer in a module called Community-Based Maternal Neonatal Health. The training manual has nutrition, it has family planning, it has antenatal, it has postnatal, it has delivery, so it's a comprehensive package. So we felt the CHVs could do mapping of pregnant women. They bring them to the community. In fact, they could tell them what happens at the facility. So it was very easy for us. In fact, it was like, for us, it was a bridge between the linkage from the home to the facility.
According to her, the Oparanya Care Program is operational in 25 health facilities across the county and targets needy mothers by encouraging them to give birth in a health facility.
There are some questions a mother is taken through that actually you can see this mother has, like she has completely nothing in her home. Oparanya Care had that incentive to give this mother 2,000 after every cycle. It is in 6 cycles. So along the 6 cycles, they get 12,000. That money was supposed to take care of the nutrition of the baby, nutrition of the mother up to that period.
In the neighboring Vihiga County, Otuchilo Care, a maternity and child health program, has now seen more mothers give birth in health facilities.
I want to see a significant improvement in maternal care in the Vihiga County, and particularly on mortality rates. I want mortality rates to have drastically declined, both for the mother and the child. by getting on this Otichilo Care program, we will have now mothers who are well informed about their health.
As long as you come below 16 weeks, you will be registered on Otichilo Care project. So for this project, we register you in the facility, the Boresha Afya Mama na Mtoto form. Then we do an MCH form when you come at first visit, and for every visit that you make, we continue registering you on the MCH form. Then at home, after facility registration, the CHVs will follow you at home. Then they will do a household tracking methodology. They'll do an HTM to be able to capture you at the household.
Hiyo mradi ya Otichilo Care ni mradi mzuri. Imetusaidia sisi wa mama. Nikienda kliniki wakati napokea hizo pesa, zinanisaidia kwa transport na kununua kwa fruits. Alafu kununua kwa vitu za mtoto, na tumiwanga 1,000 kwa kila mwezi, na tunatumiwanga kwa KCB Bank.
Walikuwa wameniambia ni nunue vitu za mtoto kama vitu za baridi, sweta, kofia, socks. Mafunzo usafi, tumia maji safi kutoka luni nawe mikono, na nikinyonyesha mtoto ni make sure nimetumia kitambaa safi, kama maziwa inamwagika ni fix hapo hivyo maziwa isimwagike sana.
This program is just not about maternal health care alone. It's got component on family planning. They have to understand once you give birth, you must have a certain leeway, a certain time frame of which the mother must take care of the child. She has to recover fully before she decides to have another child. And one of the main aims of this program is to encourage people to have small families that they can be able to manage.
While mothers across the county are now able to get better reproductive health services, information sharing to mothers during pregnancy, labor, and delivery is key.
We must have very effective communication to this mother during labor, and even during every procedure you need to know to this mother, you need to do, the mother must be informed. So you must explain to the mother, and the mother must always give you a consent. That is a very effective communication. Then after the examination, we must give her feedback. We have examined you, and this is the problem, this is the situation, we need to do this and this and this. And she will tell you, please go ahead and do so.
A report by Access to Medicine's platform done in 2018 showed a drop in access to sexual reproductive health commodities in Kenya from 46% to 36% in the previous year. Implants and injectables are popular family planning commodities among mothers in Vihiga County.
We always provide counseling to all the methods, to a mother, to all the methods. It's up to her to make an informed decision on which method they want to use. But of late, I realized that the implant has been a bit popular because it has less side effects compared to the injection. It has a low hormonal content compared to the injectable. And also, you see, the implant, if I get a side effect, I will be able to remove it and finish the side effect. But if it is an injection, then once I'm given the injection, you see, it's not very easy when I get the side effect until the drug expires from my body. That is when the side effect will go off.
Nilikuwa kwa family planning ya miaka 3. Then nikanipeleka vibaya, nikatoa, ndio sasa nikashika mimba ya huyu. Nilikuwa nenda period mara 3 kwa mwezi hivyo, sasa zingine mara 2.
Dr. Oluhano Jerusa, Vihiga County pharmacist, cites stockouts of newborn health products as a major challenge in key commodities in some health facilities across the county.
We are well stocked for program items, that is for TB, HIV, and for malaria. For the other essential medicines, for hypertension, the other infections, we are not doing so well. The stocks have been so low. The last order was received in November 2018. We have a challenge with male condoms that is cutting across, and KEMSA is still working on it. We are informed maybe from the next financial year we might be able to get. But generally, most of the people who do family planning, who take up the commodities, are the women. The men are not very proactive in the same. The other challenge we have is a particular drug that would be used for the babies if they are born prematurely, that it's used for lung maturation. but then it's in that order that is pending.
If you look at the number of hypertensive cases that you see in the hospital and the diabetics, there were quite many. Like on a normal day, if you look at the wards, you'll find 80%. If you're talking about 30 patients, 80%, meaning about 20 are actually hypertensive or diabetic. If you go to the renal dialysis unit, most of the patients who are actually there are actually due to the complications of diabetes and hypertension. So we decided and said, how best can we be able to help these patients and diagnose? So we started up by setting up a cardiac unit, a small cardiac unit within the county referral hospital.
In its 2018 report, Access to Medicines platform recommends full implementation of the FP 2020 commitments, which supports creation of functional youth-friendly centers offering youth-friendly services. However, such centers are currently unavailable in Vihiga County.
The demand is high from the young people, and we currently do not have an adolescent center. It is in the pipeline that we set up one. But normally when schools close or they are opening, you'll see an upsurge of students in groups coming to the hospitals, and they will empty the dispenser. So that shows the demand is high, and I'm not so sure if they actually utilize, because just picking the commodities is one thing and utilizing them is another.
For maternal health, the county is dependent on donor supplies for key commodities.
For oxytocin, they are used majorly during delivery and they're in hospitals because they have to be refrigerated. Normally in a month we would use like 800 to 1,000 ampules of the injectable. There's a donor who donated some IFAs for the whole county, and we have enough stores and they are being well taken in and we've seen the good impact. We have very few cases of anemia in pregnancy, and they actually know it because previously when we didn't have the IFAs, the combination of the two, iron and folic, they would have a problem taking the folic on separately and iron on its own. The misoprostol is well distributed. Most facilities store because it's used for PPH, but again it's also used to induce labor. So it's stored, and because it's a controlled drug, it could be used for abortion. So it's well controlled.
This year alone, the county has lost 3 mothers due to postpartum hemorrhage, a challenge that the Vihiga Teaching and Referral Hospital Medical Superintendent Vitalis Juma attributes to lack of consistent blood supply.
So far, I think we have lost about 3 mothers this year in the process of giving birth. More often, the main cause, as it's known internationally, is what we call bleeding, especially after delivery. And to avert that, we have a blood transfusion unit, a small unit that we are able to stock blood and adequately be able to respond to such situation. And 2, this year the governor groundbreak the site for blood transfusion as a satellite, so that it's able to capture, we are able to do screening adequately because there's a delay in screening. If we use our regional is Kisumu, but we get less than 3 pints, so they are not able to fill our capacity. So internally we go out, collect blood, take it to Kisumu where they are able to screen for us and then we bring. At times there is delay, and that's why we need a satellite here so that we are able to ensure that we have blood adequate.
Male involvement in the reproductive health matters, especially family planning, is slowly gaining traction in the county.
Male involvement is picking up. It never used to be that much, but it's picking up because we involve the community health volunteer when they visit to the homestead to talk about reproductive health. If anything, those homes that have a man, they should, when they're talking to those mothers, they should involve the whole homestead, the father-in-law of that home, so that information is taken up. It's owned by everybody.
There are small groups of young fathers that have come up to support their wives. So we encourage them to accompany their wives to the clinic anytime the mother goes to clinic. But you know, long before, it was believed the pregnancy clinic was a mother's affair. So this is a new concept for the men. It is just like menstrual management. When you tell fathers that you should buy pads for your girls, they feel, I mean, it's like, should I be involved? Because it was purely mother-girl affair. So that's why we are saying male involvement is very important, even when it comes to family planning. Because a mother cannot do family planning alone.
Basing on the current economic situation of the Republic of Kenya, family planning, I think, is the best way to go. It's also good to give ladies and women time to actually rest. So I'm challenging men. Let us actually team up with our ladies because they are our helpers biblically. So your helper should help you. You have to do it as she does it too.
In order to address the challenges of commodity stockouts, inadequate community education, and inaccessibility to youth-friendly services, Access to Medicine's platform recommends adoption of a multi-sectoral approach in the provision of health services and commodities, especially in the hard-to-reach areas. The report further recommends improved supply chain, accurate and timely quantification, client education and outreach, as well as increased budget allocations for the purchase of sexual reproductive health commodities.
At times it's frustrating when the patients come to hospital. You want to do all the best for them, but you lack the commodities. Maybe you don't have the gloves, the laboratory you do not have the reagents, then again you don't have the medications. So it's a dire situation that maybe should be looked into, such that if you can streamline the supplies, they are ordered timely, they are received timely, then I think health for Vihiga County would go to a higher level.